For those of you who just joined in the last minute or so, I said we'll be waiting until about another minute or so to allow a few more people to come and join us for this webinar. So we'll start in about another minute. Okay, welcome everybody. This is the webinar on COVID-19, considering the impact on older workers. My name is Tarani Chandola. I am one of the deputy directors of MICRA. MICRA is the Manchester Institute for Collaborative Research on Aging. And this is a joint webinar that we're holding with the Alliance Manchester Business School. This is actually the fourth in our COVID-19 series, our MICRA COVID-19 series. We've had previous webinars on inequalities and older people following COVID, communities in COVID, and immunology in COVID. So if you're interested in any of these webinars, do have a look at the MICRA website. The videos from the webinars have been saved, so you can watch them on YouTube if you're interested. Now, COVID-19 has affected all of us in many different ways, especially older people and older workers. So older workers have been affected directly by the disease. So a lot of older workers are vulnerable to the disease. In another way, they've been affected through the impact of the current recession and their labor market insecurities. So these are some of the themes that we'll be exploring in today's webinar. And we've got a great lineup of speakers. Professor Sheena Johnson, who's at the University of Manchester, Dr. Emily Andrews, who's from the Center for Aging Better, and Dr. Matt Ainsworth, who's from the Greater Manchester Combined Authority. I'll introduce them properly when we'll be going through their presentations. Sheena will be talking first, followed by Emily, and then Matt. So before I introduce Sheena, I'd just like to say, we very much welcome questions. So we'll be taking questions after all three of our speakers have done their presentations. I would like to encourage you to use the chat function in Zoom to write out your question and also indicate who that question is for. So that way we have some idea of what sort of questions you want to ask our speakers. So I'd like to introduce our very first speaker, Professor Sheena Johnson, who's from the Alliance Manchester Business School. Sheena is an occupational and chartered psychologist, registered with the Health and Care Professions Council. She's an active researcher into the topics of work, stress and health, and the aging workforce, and she's written a number of articles and book chapters on this topic. And she's a member of several research institutes at the University of Manchester, including the Work and Equalities Institute and the Thomas Ashton Institute. So Sheena, please go ahead when you're ready.
Thank you very much. So first of all, I'd just like to say thank you to everyone for joining the webinar today. I'm hoping that we can have a really interesting discussion about what the likely impact is on older workers as the COVID-19 pandemic continues to kind of pan out. And also thanks to Tarani for agreeing to chair, much appreciated. So I'm going to start by giving a little bit of background into my own research, and in particular the research that I've been doing looking at health and wellbeing needs of older workers. So my main research focus is workplace health and wellbeing. We're aware that the number of older workers in the UK is rising for a number of reasons. So things like increased life expectancy, changes in pension and retirement entitlement. And what this means, broadly speaking, is that we will all typically work to an older age than we would previously have done so. And I'm interested in what that means in terms of health and well-being at work, and what we need to understand and consider to be able to protect health and well-being in the workplace. So given this research focus, I've worked with MICRA for many years now, and as Tarani mentioned, I also head up age and wellbeing related themes in both the Work and Equalities Institute, in the Alliance Manchester Business School, and also the University of Manchester's Thomas Ashton Institute, which is a collaboration between the HSE and the University of Manchester. So I'm going to start today's webinar by giving a brief overview of the work that I've been doing looking at health and wellbeing in older workers in the transport and logistics sector. And then I'm going to go on and outline some more of the broader issues that I think are relevant to older workers that need considering, and information being used to inform decision making as workplaces continue to open up. You know, now we're sort of emerging, broadly speaking, from the COVID-19 related lockdown. So a little bit about my driver research. So in 2018, I established the Age, Health and Professional Drivers Network, and this consists of companies and other stakeholders in the transport and logistics sector. People who are interested in health and well-being of older professional drivers, so people who are HGV drivers, LGV drivers and so on. Now this sector is relevant as it's identified as having an ageing workforce and much fewer numbers of younger workers, and that raises particular issues in light of the COVID pandemic as well. So last year in 2019, the Age, Health and Professional Drivers Network, AHPD, we produced health and wellbeing guidelines, and these looked in particular at health and wellbeing workplace issues with a specific focus on older workers and what their health and wellbeing needs are. And these guidelines are available on the Age, Health and Professional Drivers Network website if anyone wants to have a look at them. Now, early on in lockdown, so March, April time this year, we canvassed all of the members of the AHPD network to see how the pandemic was affecting them and what plans they had in place to try and reduce risk to their workers, and again with a particular focus on older workers. Now remember, drivers were key workers, and as such they worked throughout the lockdown. Now some of the points we raised at that stage of the pandemic was, first of all, employers should recognise that with higher numbers of older professional drivers, this is likely to increase the risk factors of COVID on the workforce. And I'll talk a little bit more about that increased risk later. And it's also likely to increase the level of concern from employees who might be worried about contracting COVID. And that's likely to be exacerbated in older age groups given the increased risk. We advised at that stage, and we looked at best practice of what other companies were doing. We advised that companies need to not forget about existing guidelines, non-COVID guidelines in relation to physical health. So things like making sure drivers didn't work while tired, they had adequate rest periods and so on. In conjunction with that, they also needed to begin to implement and promote guidelines specifically relating to COVID. So that is things like ensuring drivers had access to hand washing facilities. There were some issues early on in lockdown about drivers being refused access to toilet facilities and so on. Also things like social distancing rules, having access to hand sanitizer, face masks, and so on and so forth. We particularly recommended that more emphasis was needed in terms of mental wellbeing support, and we're hearing more and more over recent months about the impact on mental wellbeing, and that's it is relevant in a workplace, and there is, you know, a duty of care for employers to make sure that they're kind of looking after their employees in that regard. So giving mental wellbeing support felt to be particularly relevant. And to remember that employees need good communication from companies, and this is perhaps particularly relevant for furloughed employees. You know, we've been anecdotally been hearing lots of reports of people not hearing from companies for extended periods of time, and that's likely to increase anxiety levels about you know, what's going to happen in terms of returning to work. So keeping good communication is important, and within the drivers you know, sort of population, that's a particular issue because they often work for extended periods of time on their own. They can quite easily feel isolated and cut off from other routes of communication. So trying to make sure that that was addressed was important. Now, one of the things we emphasised also was the need to provide bereavement support. Now, bereavement support is something that came out in our original health and wellbeing guidelines that were published last year. And that was as a result of older employees telling us that they didn't feel supported when they experienced a bereavement. They didn't feel like the mechanisms were there in the workplace. That's obviously important generally, but sadly maybe particularly more pertinent as the pandemic began to unfold. We advise companies to keep in really good contact with furloughed employees, and I would sort of continue to reiterate that advice. Even though people are not physically in the workplace, they still need the support of the employers. So that was kind of where we were right in March, April time in terms of gathering that information, trying to share that information. My own personal research now is thinking about looking at studies that are going to look at fatigue and working patterns, and we've included a COVID focus with that, given the implications of COVID and long-term fatigue, and considering what sort of impact that might have on the workplace and on older individuals working within organisations. Now, that particular work is obviously specific to transport and logistics, but the COVID pandemic is likely to have a disparate effect on older workers across many sectors. And there's a range of reasons we need to think about what the focus should be on older workers. And I'm going to kind of briefly outline some of those now. And I know that Emily and Matt are going to expand on some of these issues as well. So let's start with the direct health considerations. So we know that older individuals have a higher risk levels in terms of the impact of COVID should they contract it. As you get older, your risk for severe illness from COVID increases. So people in their 50s are at higher risk of severe illness compared to people in their 40s. Similarly, people in their 60s or 70s are at higher risk of severe illness compared to people in their 50s. All right, so there is a disparate effect there in terms of the severity of the illness. Now, Public Health England report shows that the higher risk groups in terms of the sort of COVID implications are older males with a higher body mass index with health conditions such as diabetes. So those are some of the risk factors, not all of them. Now, going back briefly to the older driver research I outlined, these risk factors are likely to be present in a significant proportion of employees. That particular group of employees are known. Typically they're male, typically, that we know that there are kind of health implications already there. So COVID potentially exacerbates that. So it's clear that older workers are at more risk of severe illness than younger workers, and workplaces and researchers need to think about what this means and how can we help employers and organisations to best protect and support their employees going forward. Now, related to this is the likelihood that older individuals are more likely to have existing health issues that might exacerbate the effects of COVID. So things like diabetes and severe levels of COPD and so on. And related to that is that means some older workers will be in the shielded or vulnerable group, and they have understandable concerns about returning to work. Now shielding has ended and more workplaces are opening up. Now in America, there's been calls for regulatory protections for frontline workers, especially older workers and other workers that might be at heightened risk for serious consequences from COVID. So that does raise a question of whether we need or will we see similar consideration of regulatory protection in the UK. Now at the moment, there doesn't seem to be any expectations of that happening. Employers are instead being advised to ensure that existing controls such as social distancing, good hygiene and cleaning, ventilation and so on are applied stringently to protect employees across the board. But I think we need a better understanding of workplaces and how that's going to play out to really kind of understand what the impact is on older individuals. And then finally, apart from the increased risk to themselves, older workers are more likely to have caring responsibilities for high-risk elderly relatives. And they will therefore have increased concern about that in terms of potentially passing on the virus themselves if they contract it. So there's a number of kind of health issues that we need to understand, find out more about, and then kind of design and develop advice and support to try and reduce the risk as much as we can. Putting the health considerations to one side for a moment, there are also economic considerations, and I know that Emily's going to talk about this in a bit more detail, so I'm just going to give a very brief introduction to that now. So briefly, older workers are at higher risk of redundancy and rising unemployment levels. Now this is especially concerning. We know older workers are disadvantaged and often discriminated against when applying for work, and they're also likely to remain unemployed for longer than workers in other age groups. Now in recent weeks, we've seen the UK fall into recession. We're suffering the largest drop in employment in more than a decade. Now, the furlough scheme has protected jobs to some extent, but it's sadly anticipated that we're going to see many more job losses as the furlough scheme comes to an end. Now, it's early days research-wise to understand exactly what the impact of that is going to be, but there are some early reports that are quite sobering. So, for example, an ONS analysis published this month showed that the youngest workers and the oldest workers are the groups that are most likely to be temporarily away from paid work during the pandemic. Now, we've already seen some schemes that have been announced to support employment opportunities for younger workers, but there's as of yet no focus on providing support for older age groups. The Chancellor has been urged to consider workers over the age of 50. And it should be noted that that is the group that faces long-term unemployment if they aren't given targeted support. So I think we need to see more in that regard in terms of supporting those individuals. Now, of course, some older workers might choose to exit the workforce early to reduce their risk. However, that will be dependent on their financial situation. It won't be an option for many people, and indeed it won't be desirable to many people, and organisations won't necessarily want to lose those valuable employees if they choose to exit. Some older workers, conversely, may need to carry on working for much longer than they planned due to a loss of income during the pandemic, and also pandemic-related economic impacts on pension and savings. So we might actually see more older workers having to work for a longer time than they would previously have planned to do. So that's like a little brief outline of the economic issues. There's a few other issues that I think it's worth raising as well. So let's think about sectors. So some sectors are known to have an older or an ageing workforce. For example, the transport and logistics sector, where my research has recently been based. We need to understand more about what the impact of COVID is on different sectors and the workers within them. And there are a number of studies that are already being done and being planned, and we will kind of find out more about this over coming months. You know, looking at it a different way, there is different exposure levels to COVID in different workplaces. So, for example, places like healthcare, potentially retail and teachers as schools reopen are likely to have more exposure to COVID. We need to have a better understanding about what the likely impact of that is on workers with different vulnerabilities, including age, in those particular sectors. And again, there is research that is underway and being developed to kind of fine-tune our understanding of potential exposure and the implications of COVID in different working environments. Now, one thing that I think it's really important to note is that employers are likely to have really legitimate concerns about how best to respond to age-related COVID risks, given that age is a protected characteristic. So employers do have to be careful not to have any discriminatory practices. Employers are legally obligated to ensure that the decisions they make in response to COVID do not directly or indirectly discriminate against employees with protected characteristics, one of which is age. And I think what this means is that we need better insight, better guidance in respect of that, so employers can be confident that they're not going to fall foul of discrimination laws. And better advice, I'm sure, would be very broadly welcomed by employers. So in short, there's a lot to consider in relation to the COVID pandemic and its impact on older workers. The aim of the webinar today is just to start to kind of tease out, highlight and discuss some of these issues. Research activity is ongoing. There's a lot of research going on, both in Manchester, in the UK and indeed worldwide. We will learn more in coming months and years as we continue to move through the pandemic, and we're able to kind of monitor the implementation of any changes in workplaces and changes in policies and regulations. But I'm just going to end my bit now by just arguing that given that we know the issues relating to older workers at the moment in terms of things that I've just highlighted, there is a strong argument for needing to have an age-related focus as we consider how to kind of best manage employees and workplaces to keep that risk to COVID as low as we possibly can. And I'll end at that point. Thank you very much.
Thank you very much, Sheena. As I mentioned earlier, we'll be taking questions right at the end, but please do write in your questions in the chat function as we go along. So it'd be great if you could, for those of you who have questions for Sheena, just type in the chat function all your questions that you have for her, and we'll take them at the end of all the presentations. Apologies, I speak too softly and my microphone's not very good, so if you can't hear me, I'll try and speak up so you can hear me. Our second speaker is Dr. Emily Andrews. She's a Senior Evidence Manager at the Center for Aging Better. And so she leads the work on gathering and understanding the evidence for change that will support older people to be in more fulfilling work. Emily, thank you.
Right, the final thing I need to do is unmute myself. Okay, hello everyone. Thank you very, very much for having me. Really great to talk to this group. So I'm going to be talking today essentially, as Sheena alluded to, about the kind of place of older workers in the labour market. So we're kind of talking about the economics, and essentially what I'm going to do is give you some of the numbers around the things that Sheena was outlining. And this all comes from a piece of work called Midlife Employment Crisis, which we published last week. Yes, last week, around which we did in partnership with the Learning and Work Institute. So first up, I just want to, for anyone who doesn't know, let you know a bit more about the Centre for Aging Better. So we are a charity which works to create a society where everyone enjoys their later life. We're funded by an endowment from the National Lottery Community Fund, and we were set up in 2014. We're part of the network of work centres, if that means anything to anyone, which is a kind of loosely affiliated with government set of independent research charities which try to build the evidence around what works to support particular things. So for us, it's about changes which can take place mostly between the ages of 50 and 70, what kind of interventions can be put in place to support people to age well. But we also actually work to try and create those changes that we believe are evidence-based through campaigning or through working with policymakers and practitioners. So that's us. Like I say, our goal is to create a society in which everyone enjoys later life. And in 2018, we sat down and worked out what we actually meant by that. And we mean 4 things. We mean social connections, good health, meaning and purpose, and financial security. We think those are the things which make a good later life. And so in order to get to those things, we think we need to pursue activity in 4 areas. So these are the 4 on the outer part of the daisy, starting from the top. They are safe and accessible housing, being connected to our communities, healthy aging, and what we're talking about today, which is fulfilling work. So in the area of fulfilling work, it's been our goal since 2015-16 of 1 million more people aged 50 to 69 in fulfilling work by 2022. And 6 months ago, we were saying, well, God, we're going to hit that. Not particularly through work of our own, I would say, but employment rates have been improving in this age group, partly, of course, driven by rising state pension age, but also things like a greater attachment of women in the generation that's currently aging to the labour market at all ages. So there's lots of kind of big structural societal drivers driving this thing. And so we were sitting down and going, well, we need something more ambitious. What are we going to do for 2030? And of course, now we are less sure. So we're not going to update this goal for at least another year until really the dust settles and we have a better understanding of what's actually happening in our labour market. And that's what this report was about, really, was about trying to gather the current evidence to try and get a a bit of a picture, as much as we can right now, of what the impact of COVID-19 is going to be on older workers. Now, last week, there was a new drop of ONS employment statistics, and these were really exciting employment statistics because they covered the period April to June 2020, which means we were going to be able to compare March, which is pre-lockdown essentially, and June, which is very much kind of post-lockdown, and kind of see what the impact on the employment rate was. But oh, look at this incredibly boring chart. So it's this last bit here, which is the kind of COVID impact, the change between Q1 and Q2. And as you can see, oh, pardon me, the top line, 16 to 64 overall employment rate dropped 0.2 of a percentage point, from 76.6 to 76.4%. And the employment rate among 50 to 64s, that gap persisted, but the gap remained the same size according to those high-level employment rate statistics, and the employment rate among 50 to 64s dropped the same amount as the overall percentage. So, okay, why is that? Why aren't we seeing it? The main reason is furlough, is that people who are furloughed are still technically counted as being in employment, and kind of, you know, COVID and all the, and like the job retention scheme and everything else that's happening seems to be really messing with the high level employment statistics. And so the ONS have been really great actually at how swiftly they're managing to do things and do things differently, and put out a kind of basket of indicators which we can use to try and understand what's happening. Before I move on to that basket of indicators, I do just want to touch on one thing that came out of the high level employment statistics this week, which might be interesting, and that's the economic inactivity numbers. So this chart shows the change in the economic activity rate between March and June this year, broken down by age group. And as you can see, economic inactivity, those who don't know, meaning people who aren't in a job but also aren't actively job seeking and aren't claiming unemployment related benefits. And it is just slightly interesting to note that there has been, it is still small, but there has been a 1.5 percentage point increase. Sorry, that should say percentage point, not percent. Terrible. Sorry about that. 1.5 percentage point increase in the economic inactivity rate for over 65s. So that's a bit interesting. Is that potentially pointing to more people in this age group deciding to kind of write themselves out of the labour market, either as a result of their health issues that Sheena was talking about, or due to kind of misplaced sense that the job should be left for younger people? We don't know, but just I think something to keep an eye on. But mostly these stats aren't really telling us what we want to know at the moment. So one of the other key stats we have is the claimant count. This is the number of people claiming unemployment related benefits, and the number of people aged 50 plus claiming unemployment related benefits has more than doubled since March. It's gone up by around 250,000. Now, as you can see, there's a bigger increase has taken place at that kind of middle chunk age group, 25 to 49. There's bigger numbers, but also a steeper increase. But that's still a huge number of people age 50 plus who weren't claiming unemployment benefit, who now are. So that's people who are already out of a job, but also we know that there are many people who are currently on furlough, who are the kind of future unemployed, and who we need to be watching to see if they're going to fall into unemployment when the coronavirus job retention scheme comes to an end in October. And I'm actually going to show you the stats that Sheena was referring to, which aren't the stats in the report for furlough. So this week, ONS came up with this new measure of people who are temporarily away from work, which they've kind of cited as the best, kind of most up-to-date proxy for understanding furlough rates. And in this data, we can see a clear U-shape. So this is the percentage of workers who reported themselves being temporarily away from work during that kind of lockdown period. As you can see, very high amongst the 16 to 19s, drops sharply, but still kind of then takes a bit of a gradient, and then those rates start to rise again from around 55 and getting very high once you get to 65 plus, but still very high amongst the 60 to 64s, which is actually a group I think we're particularly worried about. So this is where you can kind of take the statement, and this is actually, you know, the statement that was being made in the news this week around the youngest and oldest workers being at greatest risk. Now for this group, I imagined that just seeing these rates, you're aware that this doesn't tell you the whole story, because of course the actual number of workers age 60 plus is much smaller than those at younger age groups. So here's the number. These are the numbers of people that represents, again, over that same age gradient. So the actual numbers, of course, drop quite low once you get past 65, but still people in their 50s and 60s, you can see really high numbers of people currently temporarily away from work or on furlough. So that's around 2.5 million people over 50 who are currently on furlough. So the OBR, the Office Budget Responsibility, has estimated that around 15%, they have suggested 15% of people who are currently furloughed will find themselves out of a job, so will be soon added to our unemployment rates. So that's kind of almost 400,000 people aged 50 plus added to those who are already claiming who could potentially be out of work. So when we're thinking about, so that's one way to think about the kind of labour market impact, is about who's going to lose their job immediately. And there, I think we can say that there's a high hit on younger workers and also potentially quite a big hit on the older workers. But what we're really worried about, again, as Sheena said, was the long-term unemployed. And there's lots of reasons to suggest that, or to believe that, while perhaps younger people may lose work in greater numbers over this recession, it's the over 50s who are going to struggle the most to get back into work once more jobs become available. And for people who are in their 60s in this year that state pension age reaches 66, that's a real worry. We can't have those people at the back of the queue where we're waiting for the economy to pick up. We don't know how long that's going to happen, and by the time the economy has picked up, if people in their 60s are at the back of the queue, it could be too late. So why are we worried about this? These are kind of due to long-standing patterns that we know about. For example, over 50s who are out of work, more likely to be long-term unemployed. So this is 2020 pre-pandemic, 29% of people who are unemployed age 50 plus have been unemployed for more than 12 months, highest of any group. And another statistic we can look at is re-employment rates after redundancy, which is showing how many people get into work, back into work quickly. I think it's within 6 months after redundancy. And there you can see the 50 plus have the lowest re-employment rates of any age group after redundancy. So that's really worrying. And another set of statistics. So we know that older people, when they lose their job, are more likely to be long-term unemployed. And what we also know is that existing employment support doesn't work effectively for people over 50 as it does for younger ages. And we've got that particularly starkly from the government's work programme, which was the back to work response after the last recession, and we're really worried that the patterns there will be repeated again, and the 50 plus will be left being worse served. And again, since 2011, there's a far greater number of people who are in their 60s who are not claiming eligible to claim state pension, because the pension age has risen in that time. So we also did a bit of qualitative work. I'm aware I've probably been talking for too long, so I'll just really briefly say what those are. That the people that we spoke to who were either lost their job or had been furloughed since the pandemic cited skills gaps in applying for jobs and seeking work. So that's not actual skills gaps in terms of being able to use Microsoft Office. That's the skills needed to actually apply for jobs. That there's been a big shift of job applications online over the last 10 years. The older you are, the less often you move jobs. So it might have been applying for a job and looking for work might have looked really different from the last time that these people look for work. So there's some support there. Even if someone knows how to use a computer, might still need help familiarising themselves with the new modes of looking for and applying for jobs. Then there are, of course, the new skills that adults of all ages are going to be hit by if they're in sectors like events and hospitality, which might contract quite a lot. Flexibility, again, we know that that's really important for people in their 50s and 60s with a health condition or a caring responsibility, need flexibility, and often either the jobs that are available or employment support and training opportunities don't meet that flexible need. Ageism is hard to evidence externally in the world. So we believe that older people are discriminated against. Indeed, there is evidence, there are kind of CV studies which show that older people are discriminated against in recruitment, and we're currently doing a big project about that. But in particular, COVID related, and again, this relates to something that Sheena was saying, that there was this real fear amongst our interviewees that people kind of associated with that risk group in their 50s and 60s, and so people not wanting to give them a job. And that then kind of leads to internalized ageism, people not having the confidence to put themselves forward and maybe writing themselves off out of the labour market, which is a real worry. So finally, what should be done? I'm going to just tell you our kind of 3 high-level recommendations. There's a lot more detail in these in the report, and a lot more detail, I think, still to be developed. So new back to work support can't repeat the mistakes of the work programme. By that we mean that there needs to be both actually a really clear message given to work coaches, job coaches and job seekers themselves that over 50s are just as entitled to just as good a support and to work as younger people, and that that kind of parking that we might have seen in the 80s and 90s can't be acceptable at this time, but also that needs to be aligned with actually something a bit more robust. So I think even if we're not going to have a load of a big kind of extra load of money from the Treasury to fund specialist 50+ employment support, what we can have within the existing offer for long-term unemployed or other kind of employment support for adults that's being commissioned is a kind of service standard or a service agreement that will assure that over 50s are entitled to deeper support if they want it, just as people with disabilities or other barriers to work should have access to that. So, you know, more time, for example, with a job coach, and also some kind of targets to go with those service standards. So the second thing is that we need to make sure that there is more funding made available to adult retraining. We've seen a lot of money for younger retraining, but we need more of that. Adults of all ages, so over 25s as much as over 50s, but that needs to be made suitable for people over 50. We haven't much talked about this today, but also we are quite worried about the financial hit and people digging into their savings, and we want to know more about that. So that is the report. That's my email address, and look forward to hearing any questions.
Oh, thank you very much, Emily. It's so interesting to see all that data, all the recent data come out, and very good quality data as well. So as I mentioned, we'll be taking questions right at the end after our final speaker, but please do write in your questions in the chat function as we go along. So I'd like to introduce our final speaker today, Dr. Matt Ainsworth, who's the Assistant Director for Employment Strategy at the Greater Manchester Combined Authority. Matt is responsible for the delivery of the employment aspects of the Greater Manchester's Devolution Agreement and the priority around good jobs. And he's been working particularly around the Working Well program that has been developed in the Greater Manchester area. So thank you, Matt. Whenever you're ready to go, please go ahead.
Thank you. Thanks very much, and thanks for inviting me today. And an extra special thank you for the honorary doctorate which you've given to me, which I don't think I deserve yet. But thanks anyway. So what I want to do is, I think it's really helpful that Sheena and Emily have gone before, because the role of the combined authority is as much about trying to influence policy, but also certainly over the past 5 years, translating that policy into action and delivery on the ground. So hopefully some of the stats that have been talked about today, and some of the suggestions that have come forward from Emily's research, we can bring to life a little bit in terms of what we're planning to do across Greater Manchester. So I'm just going to try and share my screen first, and hopefully this will work. And before I go into the things that we're going to do and explicitly around COVID, I think it's useful to take a step back and look at where we were prior to COVID. And it's quite interesting just how quickly things can change over such a short period of time. Because prior to COVID, actually, we had almost full employment in Greater Manchester. Had years of significant economic growth. Nobody could have missed the kind of sea of skyscrapers across the city and across the landscape. However, that did hide some significant labour market inequalities. And in terms of the role of me and my team, and the focus is, over the past 5 years, has been very much around tackling those long-term labour market inequalities, particularly inequalities around health-related disability inequalities and age. And what we have seen over the past 5 years is a kind of shift of power to an extent from government to areas like Greater Manchester, where we've been able to move away from some of those very large-scale programs like the work program that Emily talked about, and start to think more about actually what is required for the individual. How can we take a more holistic approach, and how can we ensure we are genuinely supporting those with the greatest need on that journey back into work. And we've had some significant success in that area through our Working Well program. Thousands of people now supported, and some fantastic case studies of people who in the past wouldn't have got anywhere near a job have been supported. And more recently, also focusing on what we can do to tackle in-work poverty. So although we had very low unemployment prior to COVID, actually in terms of in-work poverty, some really worrying statistics for Greater Manchester. Significant numbers of people on 0 hours contract, lots of people struggling to escape the poverty trap even when in work. And we've developed programs to ensure that people who are at risk of falling out of work due to poor health are supported quickly. People who are newly unemployed are supported quickly, and also struggling people who are struggling who are self-employed in the gig economy. So a lot of work in that space, and increasingly trying to shape that discussion with employers as well, to move towards a discussion of good employment. So not just any employment is good, but actually good employment. And it was a key focus of Andy Burnham's manifesto, as kind of Mayor of Greater Manchester, around kind of secure work, paying the real living wage, around flexibility, around health and well-being being a core part of work. So all this work, some fantastic work was underway prior to COVID. But in terms of older workers, older workers account for 18% of the working age population in Greater Manchester, but prior to COVID accounted for almost 30% of our economically inactive population. And we know that from previous recessions, as Emily touched upon, older workers fared poorly and took longer to get into work. And despite some of the real good progress on things like our Working Well program, which have achieved some fantastic outcomes in comparison to what's been there before, the statistics still show that older workers, older people supported through our programs, were still faring worse than their younger counterparts. So all of that is again a context of pre-COVID, and then COVID hit, and it's completely turned the economy on its head. And the statistics for Greater Manchester, I'm not going into loads of detail, are genuinely worrying. And I think we've given up trying to do forecasts because it's really hard to understand exactly what will happen. I don't think anybody really knows. But we've looked at a number of scenarios in terms of how far do we think unemployment will go, and we've got some scenarios which suggest it could be as high as kind of 15% unemployment. Actually, worst case scenarios, if it's truly catastrophic, could see an unemployment rate of approaching 20%, which is just phenomenal for someone like Greater Manchester, phenomenally worrying for someone like Greater Manchester, absolutely dwarfing what happened in the last recession. And if you listen to some of the things that kind of Bank of England have said, actually, a slightly more positive scenario, and things might get back to the way they were a bit quicker. And I think the truth will be somewhere between scenarios one and three. Hopefully, it won't get anywhere near scenario 2, but some real concerns. And if previous recessions, if we follow similar trends to previous recessions, what we do know is that and including, you know, the stats that Emily touched upon, older people and younger people are going to be the most harshly affected by this, and that's where we need to focus our attention. Now, in terms of pulling this work together, so Greater Manchester is proud to be a kind of World Health Organization age-friendly city region, something that colleagues have worked really hard to get. And we've got a fantastic relationship with Centre for Ageing Better and with government departments. And a piece of work has been underway, led by colleagues of mine like Hannah Scriven, who I think is on today in the audience today. You know, been really kind of pushing this agenda in terms of addressing labour market inequalities for older workers and for older people. And we've got, you know, a really powerful group of people who are looking at things that are within our gift to make a difference. And I want to kind of touch on some of the things that we're actually doing now, some of the things that we're pushing for, and also where we think some opportunities may lie. And so just taking a step back, through devolution, and this is one of the points that Emily touched upon, we've seen significant control and transfer of budgets from central government to Greater Manchester. So we now commission in the region of £300 million worth of skills and work provision. And one of the things that we've been able to do through that is overtly and explicitly put a focus on older workers and older people in much of that provision. So it's captured in terms of all of our data. It's there front and centre in terms of our comms. However, as I said earlier, in terms of outcomes, still lagging for older workers, and we don't know why that is. And I'll touch on some of the work we're doing to try to fill some of our intelligence gaps at the moment. But just in terms of some of the kind of responses, some of the positives. So, you know, I think it was positive to see the Chancellor respond quickly in terms of COVID, in terms of putting more money into the skills and work system, and you know, and some huge numbers and some huge programs were identified in the summer statement. I think it's fair to say, and a concern of ours was that there was the focus was more clearly on younger people. And we'll be keen to ensure that anything that happens in Greater Manchester, that it doesn't pit kind of younger people against older people in terms of kind of priority into the funding and support. And that's something we're certainly challenging government on. But there are some opportunities there. So we've seen just in Greater Manchester significantly more investment in our work and health programme called Working Well, which we are focusing on older workers. And we think there's an opportunity coming up through the spending review to really push for more investment in skills and work interventions. And as Emily said, we'll be pushing for investment in a new long-term unemployed programme, which ideally we would like to be devolved to Greater Manchester, and which ideally we would then be able to make a clear focus on older workers as part of it. So that's something we would very much like to see, as well as an increasing focus on skills spending for older workers, both in terms of people who are in work, which might be about reskilling, retraining, moving into other careers or progressing, but also in terms of skills training for people who are unemployed. Because again, we know that the skills spend is still focused quite heavily on younger people. Now, I'm going to just come back in a moment to our pilot, which is really exciting, and just touch on briefly the kind of age-friendly employer guidance. And so we've been working hard to try and get some key messages out to employers about the benefits of employing older workers, about retaining older workers and progressing older workers, and perhaps I see that perhaps there's an opportunity through COVID to kind of what I call kind of resetting the workplace. So I think one of Emily's recommendations, and I think it's something that Sheena said as well, was about, you know, what we know works in this space is flexibility and flexible employment. And actually, we've seen businesses change the way they work in a matter of months, in an incredible way that perhaps in normal times may have taken years. So the number of people who are now able to work from home, able to balance care and responsibilities with work responsibilities, businesses seeing that actually presenteeism isn't as important as what they thought, that productivity can still be maintained with people working in different ways. So for me, I think we've got a genuine opportunity to kind of grasp that now and to try and take that forward, because one thing one thing we shouldn't allow happen, and we'd be travesty if we did, was to let business practice go back to the way that it was prior to COVID. So for me, that's an opportunity. But I want to kind of finish on briefly just some of the really exciting work that we're doing with the Department for Work and Pensions and Aging Better, which is really taking a bottom-up approach to employment support for older workers. Because as I said, despite all of our best efforts and despite our focus on support for all older people, which we're still not achieving the outcomes that we would like, or we think older people deserve. And we've kind of tried to kind of flip the question a bit, which I thought was, if we can configure support around need, could you genuinely achieve better outcomes? And how can we work with older people across Greater Manchester to help us to kind of co-produce, prototype and pilot, test on new ways of working and supporting older workers? And it's great that we've got this kind of tripartite agreement with DWP and Aging Better to genuinely test that in 4 localities across Greater Manchester over the next 12 months. And for me, we could get some really rich, interesting data and intelligence that comes out of that might fundamentally change the way in which we deliver our services, and the way we commission our services through a more bottom-up approach. It's something I'm really excited about, something which I think is truly innovative, and something which I think can really help long-term thinking and support in this space. So I'm going to leave it there, and hopefully we've left some time for some good questions and discussion. Thank you.
Thank you very much, Matt. So it was really interesting to hear about all the recent work that the Combined Authority is doing in this area. So thank you for alerting us to that. We do have some time for questions, but in the chat, I've noticed all of you have been very quiet. So please do write in your questions. This is also an opportunity for those of you who don't mind showing your faces. Please do switch on your videos so that the presenters can get a chance to see at least some of the audience. So please don't be shy. If you're comfortable to show your face, please do so. Please do ask your questions in the chat. And while we're waiting, I do have a question for all our presenters. Which is, if you remember, in the very early stages of the pandemic here in the UK, though, in the NHS, there was a call for recently retired NHS workers and doctors to come back to the NHS, and it was really heartbreaking to see, 2, 3, 4 weeks later, the death statistics rising, or at least the number of cases. So I was wondering whether that sort of put the fear in a lot of older workers about being called back to work and potentially being exposed. So really, apart from the structural issues about older workers and employment, is the fear of catching the disease a big potential barrier in the pandemic? And whether there's any anecdotes or research coming out on this.
I mean, I'll take that. I mean, I think the answer in short is yes. I think people are fearful, and I think understandably fearful as well. And it's something that I touched on in terms of that as things open up more and people are returning to workplaces, that these fears are going to be compounded. And people, I think there's been reports in the news today saying that people are being forced to choose between kind of health and finances. And that's something that I think Emily touched upon as well, that idea that people are sort of drawing on savings and so on to try and keep themselves in a safe place. Now, the true answer as to what the actual risk is, I don't think is very clear at the moment, because the things are changing and there are risk mitigations being put in place. But I think the fears are very understandable and very real. So I've got family members who are shielding or fall into risk categories, and certainly those are very difficult decisions if you feel you're going to be putting yourself into an unsafe environment. Now, some employers are being very, very careful in terms of making sure their workplaces are COVID secure, and there are good guidance in terms of what employers need to do, but there are certainly employers who aren't adhering to that as well. You know, so depending on the type of work that you do and depending on the type of kind of, you know, the health concerns that you have, will kind of, you know, kind of drive that decision making. But there will be some people who don't have a choice. You know, they have to return to work because financial considerations mean they have no other option. And I think research is not clear yet in terms of what that means, and I think that's because the situation is so rapidly evolving. But I think it's important that we kind of highlight these concerns. Emily, I don't know if you want to come in on that.
Yeah, I mean, I suppose perhaps it's the kind of question we were asking, and it's a very small, but the work from our stuff and also the stuff that we've done with, we did a survey and some core work with Ipsos Mori, is that more generally, and it's, I mean, especially of course at the younger end, that the fear is of not, there's also just this big fear of not working. You know, as well as a kind of a health fear, there's also just that people are just really scared about their economic future. But I'm aware that we didn't ask that could be a kind of a product of who we were talking to. So we've actually got some work that we've just commissioned from the Institute of Employment Studies, who are, it's kind of a longitudinal qualitative study with people in their 50s and 60s who were in work before the pandemic hit, but may now be in work, or they might be furloughed, or they might be out of work. And we're talking to them, they're interviewing them at the moment, and this is over 50s with a long-term health condition or with a disability. So the kinds of people who are going to be particularly worried about that. So we're talking to this group then, and we're also following up in March to then kind of, you know, to find out what's happening. I think that's going to flush out some of those concerns. And what's also interesting is that, you know, there was a point at when the pandemic hit and we went into lockdown, and everyone was like, we need to understand what's going on now, and everyone's working on a 2-month horizon to kind of get findings and get recommendations and make change. But you know, this work is going to come out in March, and I don't think that's too late at all. I mean, I think there's things that we need to be pushing for now, whether that's an increase in statutory sick pay, or whether it's an extension of furlough for people who are in the shielding group, a reinstatement of shielding as a category. But I think this is going to rumble on. So that's just to let you know that there's more stuff coming out, and I agree with everything she said.
Thank you. So there are a couple of questions for Matt. One is from Lynn. Lynn, do you want to unmute yourself and ask the question?
Here I am.
Yep.
Hi. Always interested to hear where trial programs are taking place. I wondered which bits of Manchester the 4 you mentioned were going to take place in. It was towards the end of what you were saying.
Yeah, sure, happy to. So the 3, we've got 4 areas identified, three which are definitely going to start. So we're looking at Wigan, Manchester and Trafford. So some very different parts of Greater Manchester, very different communities. And we've commissioned a design partner called Humanly, who are taking on that kind of community development, community engagement work in each area, so working with the kind of local authorities and other partners to take that forward, so we can genuinely start to engage older residents in those areas. Admittedly, COVID has made it slightly more challenging, and the specific lockdowns in Greater Manchester have made that slightly more challenging than we would have liked. So some of that work is having to be quite agile, I suppose is the right phrase, in terms of how we approach it.
As boroughs, I think you answered the question regarding boroughs, but to me that's not a neighbourhood.
No,
I just wondered which bit of Manchester, to be honest, and I'm on the border of Trafford, so it's always interesting.
Right. So at the moment, the boroughs have been identified. There's still a little bit of discussion underway in terms of specifically which neighbourhoods within those boroughs we're going to focus on.
Right.
But we'll be able to share more information through Sheena and this group of needs if people are interested, in terms of both how we can share more information about the project itself, and then also how we can ensure that people are kept abreast in terms of which areas, what the learning is, and hopefully there's some people who want to feed into that work as well.
Thank you.
Thank you, Matt. There's also a question from Christine, Christine Parker. Do you want to show yourself if you can and ask the question?
So I'm just wondering, you were talking about the tripartite working with Centre for Ageing Better and the DWP, and I wondered if there was anywhere we could go to look at more details of that, of what you do in that. Oh, Emily's got an answer. Sorry if I missed it. If you're,
I'll put it in the chat. I'll put a link in the chat.
all right. Thank you very much. Thanks.
Brilliant.
Never saw your lips move, Matt.
And there's a question from Helen Gilbertson on the 10 sections of Manchester. So which ones are being chosen? Helen, do you want to unmute yourself? Or maybe if you can't, I can ask the questions. I think this is a question to Matt about which sections are being chosen from Manchester. So I think that might be in relation to the program that you were just talking to Lynn about.
Yeah, as I said, there's still discussions underway in terms of specifically which localities, which neighbourhoods in Manchester, and the kind of the three boroughs where this will happen. So it's not confirmed yet. So we're kind of sharing this information at really early stages of the program.
As you can see, we have a very keen audience to see what's,
which is great.
What's being done.
Yeah, fantastic.
Well, we're slightly over time, so I'd like to thank all of our speakers today. I think they really gave such an interesting set of presentations on this really important topic. So a big thank you to everyone, and also all of you for joining in. If you're interested in seeing a video of this recording, it'll be up on our MICRA website, so please do have a look, or any of our previous webinars as well. So thank you, everyone, and have a good day. Bye-bye.